Welcome to Healthcare Innovation Trends from the Trenches. I'm Andrea Simon, and today's topic is increasing revenues while executing your cost-cutting strategies. I'll tell you a little bit about our speakers today and a little bit more about the webinar series. First, I've set this up 2 years now. This is our 17th webinar. I'm an anthropologist, and I work with organizations that need or want to change. And about half our clients are healthcare related. This is clearly a time for healthcare innovation and change. I've also conducted over 200 workshops on change matters and blue ocean strategy, and we're innovation games facilitators and trainers. Our presenters today are absolutely wonderful colleagues to work with on this topic because we're beginning to see all sorts of interesting changes taking place in how healthcare organizations are beginning to look at their expenses, call centers that used to be unnecessary or irritating into great opportunities. So let me introduce them. Matt Henning is going to speak with Colin, both of whom are from Stericycle companies. Matthew has over 20 years of healthcare experience and 5 years as an ICU RN, which is just fascinating by itself. He leads a national team of healthcare communication consultants, and he'll tell you some good stories about healthcare communication and why this all ties together here. But he really is focused on developing communication strategic partners with health systems. And his expertise is in helping organizations meet and achieve growth through development and launch of market channels. Colin has enjoyed a 20-year career in software and information technology, and the last 10 have been in healthcare IT, which you know is an absolutely marvelous and fascinating arena to play in. He's a registered professional engineer, and he's a marketing veteran. He prides himself on knowing how to assess, attract, and engage target audiences through different media channels. And I think that one of his claims to fame, he's co-founded one of the most popular healthcare tweet chats, Healthcare Leadership, which attracts 150 more participants and generates over 11 million impressions each week. So I'll give you their emails at the end, and you can connect back with them if you like as we begin to proceed through this presentation today. A little bit about the webinar series. I'm an anthropologist, and we've been trained. I often tell people that Undercover Boss is my best advertising because our job is to stand outside a company and take a good look at what's going on inside. And people all too often don't really know what they're doing, what their pain points are, and what is really happening experientially. They can tell you what they think you want to hear, but until you actually watch them, you really don't know. And what we were watching, and every one of the speakers in our webinar are colleagues, some are consultants, some are leaders in healthcare institutions, but they're seeing things happening and they need to begin to talk about them and begin to discuss how to adapt to them. Recently, I was asked to write actually a series of articles that are coming through on call centers and what's changing. And so I wanted to set this up in terms of what we see happening. There's clearly an emerging and very powerful new focus on what was forever an expense. Amita Health was one company I interviewed out in the Chicago area. And what was so wonderful about the work they were doing there was that they had truly realized that the call center wasn't an expense, it was a revenue potential, had huge revenue potential. They had 70,000 calls a year, and nobody was paying attention to them. Now they have 15,000 appointments, and that's up from 11,000 the year before. And they can show their chief financial officer how their investment in a high-touch call center, they stay on the phone and they make sure that person has an appointment, and then they make sure that person comes to the appointment, and sometimes that person even calls them to find out how to get to the appointment. It's become a very different high-touch relationship. Relationship is real important with the new consumer. This is research that we did for a client, and we were working with a medical center-based cancer center about the experience. And we wanted to shop the experiences and compare theirs to others in the markets. So we went out and what we did was we pretended we had a friend who had been diagnosed with cancer, prostate cancer, lung cancer. And we contacted over 20 hospitals in the Northeast region. And so we began with that wonderful phone experience. Hi, I have a friend who's been diagnosed with prostate cancer. Can you connect me to the right place so I can find out more about your approaches? So the answers were, what's your patient's name and what room are they in? Or where did they have them diagnosed and you should go back there? Or I'm not quite sure where to send you, so I'll send you someplace, which got us to a telephone tree that said billing push 1, doctor's appointments push 2. Very, very little interest in making sure we found the right doctor to become a patient of, except for Cancer Treatment Centers of America. What did they say? I am so sorry to hear about your friend. I am so sorry. You must be very concerned. The empathy was tremendous. The process extremely well designed. And what they understood was that we had taken an active role in reaching out to find a solution on behalf of our friend or our father, or whomever it was. It seems that few hospitals get the fact that we're calling with potential business, but instead they're much more worried with how to get us off the phone. In September this past year, Chris Baird did a marvelous webinar for us on patient experiences. And one of the slides you can go back and take a look at, but it's perfect for here, for our conversation today. And she had done research for one hospital system on their inbound call experience. And she asked those who had called, how likely are you to seek future care at this organization? Almost half said they weren't coming back. The switchboard manager told them why. Their goal was to get rid of the caller in 15 seconds or less, not to make sure they became a patient, or they had their needs satisfied, or they got a good experience. They had 900,000 calls a year, and from a cost-benefit perspective, this was all expense reduction. So as I set up Matthew and Colin, keep in mind the following 2 quotes. The first one, the real voyage of discovery consists not in seeking new landscapes, but in having new eyes. And what they're going to show you today is how, if you only looked at the cost cutting in a new way, you could see the revenue potential that's right before you. And this one I just love. Anise Nin is a French diarist, and she writes, we don't see things as they are, we see things as we are. Remember where I started as an anthropologist, we try to see things as they are, and people really don't want to see them that way at all. So let me turn this over now to Matt and then to Colin about how do you turn cost cutting into revenue opportunities.
We'll start with kind of just the general healthcare pressures that are out there today. What we found is when you look at all the things going on within organizations, so whether or not it is ACO or population health or absorbing more physician practices or better alignment, all of these physical things come down to, can you communicate better? And we have a pretty deep relationship with a major academic medical center out west. There's a quote that they shared with me that has stuck with me for years, not only just as I think back to being a nurse at the bedside, but also in the environment we're in today. What they said was that we are really, really good at taking care of people. The challenge is we're not good communicators. It's not our core competency. Our core competency is taking care of people, but communication has never been something that we've had to be really great with. And with the healthcare environment today, moving especially beyond the 4 walls, when we look at all this stuff going on, and we hear it from our customers all the time, is that there's so many things that they're involved in. And these things that they're involved in these are big initiatives, and they require a ton of resources. What happens in that environment is there tends to be a little bit more focus on cutting costs and a little bit less focus on looking for areas or optimizing areas where you really can boost revenue. It's one of those things that is maybe not talked about a lot, but we find that if you can focus on some areas of revenue, the downstream impact to actually reducing cost is there. You just have to look for them. We've dialed this into, Andrew, you can go on to the next one. We dialed into a couple areas where there really are revenue opportunities that you can focus on that don't have to be these major initiatives, but they're kind of hidden a little bit. So you look at patient-consumer abandons, and really abandonment is just not being able to answer the phone on time and people hanging up. These are typically simple areas that you can implement something, or at least implement a service, or either do it yourself or have someone else do it, that can start to answer the phone more consistently. And then the fill rate is, of course, are you filling your physician schedules or department schedules? Are you optimizing those? And by optimizing those fill rates, the revenue impact is hard dollars to the organization. This is really so if the capacity is already maxed out, this has a little bit less impact. But if it's not, then these are definitely areas that can impact the revenue. And then again, this general concept of patient satisfaction. What we've seen is it's a little bit harder to pinpoint the true dollar impact to patient satisfaction, but we do know that patients can have a choice. And so if you're not picking up the phone when you should, and people are dissatisfied, it's pretty inherent or just human nature to go to somewhere where you are satisfied, where you do have a good experience. And there's some pretty easy things to implement that start to really impact this overall patient satisfaction. And then again, no-shows. And Colin's going to go into a little bit deeper on some case studies of some quick wins that you can look at within the organizations that really do optimize the revenue. Again, this general concept of just focusing on cost cutting tends to be problematic. The revenue growth becomes a little bit more of a secondary goal, and we believe that the focus should be a little bit more on the revenue side of things, because if you take care of those areas, the patient satisfaction goes up, the experience ends up going up, the bottom line is impacted, and the focus is probably a little bit more in line with the organizational goals. So there's this evolution of interaction that has happened over the past several years. In the past, it was pretty simple. It was the phone. People would pick up the phone to either gain access or navigate through a health system or a physician office, but it was pretty siloed and pretty simple in that manner. Well, now there are other ways to communicate, and people like communicating in different ways. So whether it be chat or phone or being online or even text or utilizing capabilities from a smartphone aspect, there are ways to communicate better with patients that not only just increase satisfaction, but end up impacting revenue, communicate in a better way and the way that your consumers want to. This lack of, what we see is from a lack of consistency standpoint, that if you are inconsistent or siloed in your environment, whether or not it's how you schedule appointments, or if it's differences between physician practice on how they answer the phone or how they answer questions, or if just the overall experience is different, then not only just the image gets hurt, but the downstream revenue impact is greatly increased if you don't have consistency across your organization. And again, this kind of comes back to what we found is there really are some areas that don't have to be boiling the ocean type of initiatives, but you can really focus on a couple key areas that have major impact to the organization on several areas within the continuum of care. So this is just a depiction really of a lot of organizations that end up aligning themselves with community, or whether or not it's buying practice or this is more from a hospital health system standpoint. The challenge here is that the timing is not lateral, so it's almost stacked. So in this example, practice A comes on board and is aligned with the healthcare institution, and then shortly thereafter, maybe practice B comes on, and they may utilize an in-house contact center. Then you have practice C come on, and they may have their own contact center, and practice and so on. What ends up happening is there's so much focus of kind of onboarding and integrating the practice or the department within the health system, that what ends up getting lost is the way that they end up communicating with their consumers or patients. So again, in this environment, practice A and practice B end up having separate reporting, separate billing and messaging, and this overall patient experience is specific to one group, and then with practice C, everything is a little bit different. These inconsistencies are a major challenge, because then the health system or even the doctors really don't have good data to make better decisions. And you can see in this environment that there are a lot of resources that end up getting pulled to managing several different relationships across these major departments, that as organizations are trying to represent a brand, but there's not brand specific initiatives that are really happening. As we go a little bit deeper, the staffing challenges that end up happening that tend to impact the revenue. So if you go back to the example within kind of practice A and practice B, is the volumes that come in it would be great if they all came in a scheduled time across the day. So what ends up happening if you have a 5-physician practice or 10, and whether or not you have dedicated staff or not, the volume or the ebb and flow during the day is different. So typically in the morning, or maybe even on a Monday morning, it's even higher, or even after a holiday. In this example, this practice is staffed with 4 dedicated agents to answer the phone and schedule appointments, refill requests, and change appointments, and so on. But the call volume is so erratic throughout the day that you can see on the right-hand side, there really is an inability to effectively answer the phone. So in this environment, the abandonment or people sitting on the phone for 5 minutes and ended up hanging up was a direct result of just not having enough resources. The challenge for a lot of practices or even hospitals, is you can't staff 8 people or 9 people for 2 hours and then kind of back to 3 and kind of back to 4 and then increase it just after lunch. But the inconsistency really do impact the revenue. So this is more of this depiction of the ebb and flow of the day is a major distraction to revenue if you can't answer the phone. So in this environment, this is kind of more of a best case scenario. The timing is still consistent. But if you can centralize some of the interaction, then you have decreased the amount of resources needed to manage the reporting, the billing, the messaging, this overall patient experience and care. What a lot of people look at this slide and say, well, centralizing becomes this massive undertaking to centralize everything. What we found is you don't have to boil the ocean. This doesn't mean that you automatically move to a centralized area where you have a centralized call center. It's just being able to take some really key areas and be consistent and not siloed. So, for example, we often hear from organization when we show a slide like this, and we end up asking, how many vendors do you use to answer your phones after hours? The majority of the time, the answer is we don't know. Or once they do some digging, it's 7 or 8. Those inconsistencies, and again, the amount of resources that are being taken up to manage contracts and relationships and pull reporting together for all these different areas, becomes a quick area that if you can centralize those into one central area, whether or not you do it yourself or utilize an outsourced vendor, you really are saving money in different areas. And then you have better information and a better consistent experience for your patients because everything is, you kind of have one area to go to. So Colin's going to get a little bit deeper into case examples, but again, I think the overall message that we've found with our customers is that there's so many things that they're focused on. However, if you can pick apart some really key areas in quick wins, you really can start to impact the revenue. And if you don't have a really good handle on access, all of these things can really do impact not only the initial revenue impact, but the downstream revenue. So long hold times or high abandonment rate, that is missed dollars. Vacancies in your schedule, those are complete missed dollars. We see it with radiology as well, is that if someone doesn't show up for an appointment or that fill rate is not there, those are real dollars. And not only it's the missed reimbursement of that fill for, let's say, an MRI machine, it's the not utilized that you're still paying the staff. So there's almost a double effect if you're not filling that slot.
Yeah, hi, good afternoon, everyone, or good morning, depending on what time zone you're in. Yeah, so as Matt was saying, I'm going to dive a little bit deeper into a couple of areas of your organization that you might not think about as an opportunity to improve revenue. And the area I'm going to focus on really is your schedule, a lowly schedule. This is a really great area for those quick win projects that Matt was talking about that we want to highlight to you that can really have a significant impact on your bottom line. So you heard Matt talk about the abandonment rate and how when you don't have a centralized operation or when you have a very siloed operation in terms of answering the phone, how their patients won't get their phone or their call answered by a live person. They'll go to voicemail. When that happens, that's a missed opportunity. That's an opportunity you could have had to fill your schedule. This is a patient that wanted to see you, maybe looked up your great reviews online and wanted to come in, but because they couldn't get to a live person, They might leave a voicemail, but more likely what they'll do is hang up and try someone else on their list. And so, just by looking at that number, that can have a $1 million impact on your bottom line. Just, increasing your schedule fill rate, as the slide is indicating, by 3 to 5% can really result in some significant dollars being added to your organization. But the example we have here on the left is really talking about a practice that has about 10 providers, an average appointment value of $200. That's how it translates into millions of dollars in a given year. I guess our basic message here is there are opportunities in your organization for revenue enhancement without having to really spend a lot of time and significant resources. Filling your schedule, answering the phone is one of them. Another way related to the schedule is making sure that the schedule you do have actually happens. And what do I mean by that is really looking at the no-show problem. Now, no-shows, they vary obviously depending on the type of organization, the specialty, provider, location, a lot of factors. But what we have found through our experience is that no-shows tend to be, in a similar band. So if you're in the chart I'm showing here in that middle column, what we're showing is that we typically encounter organizations that are not doing any sort of patient outreach for appointments. So they're not doing any form of appointment reminders at all. That's likely because they just don't have the staff, they're just so busy, they can't get around to it. Those types of organizations are experiencing a no-show rate of anywhere between 12 and 15%, which isn't bad. I mean, it's not bad. But if you take that percentage and you consider an example of a 5-provider practice that, 40 appointments per provider per day, at $125, that will translate, that 12 to 15% translates into about 6,000 to 7,200 no-shows in a given year, which translates into 750,000 to 900,000, that should say, per year, lost revenue. That is a big number. Now, we have worked with some organizations, and we have observed a lot of organizations who have some form of manual appointment reminder. So that may be a letter, that may be a phone call. And for those organizations, we see an improvement. We see a no-show rate of typically between 8 and 10%, which you can see at the bottom line impact about 400 to 600,000 in this fictitious example of a 5-provider practice. You can see already just by doing a very, very manual process, you can significantly improve your bottom line to the tune of $300,000 to $400,000. That's pretty good for just picking up the phone and dialing outbound to a patient to remind them of their appointment. So let me give you another example. I'll go through a case study that we actually did with one of our larger customers. So this customer was doing sporadic reminders. Right? And what that meant was, they had some frontline staff, they had a receptionist who doubled as the person checking in new patients. This is a hospital. When this person had time, they would look at the schedule, a couple of days from now, and then start to dial the patients just to remind them to come in. But it wasn't something that it was dedicated time for. They never got through all of the patients. It was very sporadic. And what they were experiencing was about an 11% no-show rate. We came in and we implemented with them an automated 2-day phone reminder. So 2 days out, what we would do is automatically, using a recorded voice, send a message to these patients to say, "Hello, Mary. We understand you have an appointment with us on this date and this time. We just want to remind you of it. And by the way, we would like you to arrive 5 minutes early so we can get you checked in and everything will be running smoothly." Just by doing that one phone call 2 days before, they were able to lower their no-show rate by 4.75%, which translated for them into an extra 108,000 appointments made in a year. So remember, these are appointments that were already in your schedule, but they weren't showing up. So we were able to ensure that an extra 108,000 people or appointments actually happened. And this we stayed here for a while, but then we said, we think we can do better. And through some technology, what we were able to implement with them was this concept of a drip protocol. And what this really means is that instead of just one outreach, we do a series of outreach in a standard protocol that if they don't respond to one part of the protocol, it escalates to the next one. So what do I mean by that? 5 days before, what we implemented was that an email would go out to that patient, an email reminder to say, "Hey, you have an appointment coming up." If the patient did not respond to that email, we then sent that recorded voice message 3 days before the appointment. If they didn't respond to that voicemail, we then sent a text message to them the day before the appointment. And using this drip protocol, what we were able to do is lower their no-show rate by another 50%, bringing it all the way down to 3.15%, and this represented an additional 76,000 appointments. So you can see this is a big difference from 11%, and in total, if you look at this, we saved this organization 186,000 appointments in a year, which at a conservative estimate of $100 per appointment represents $18.6 million a year to their bottom line. Now, I know a lot of people will say, well, we charge a no-show rate and, it's really not that bad of a problem. We hear this all the time, and it very well may be true that you do charge a no-show fee, but there's always that problem of collecting it. There's always that uncomfortableness of asking a patient to pay you for an appointment that somehow got missed. And of course, there's the missed opportunity of actually filling that appointment slot with someone who really needed it. This can be very significant. And let me give you a couple more examples. Here's an example of an organization, 35 physicians spread across 13 locations. It's cardiovascular practice. We were able to reduce their no-show percent by 3% absolute value, which translated into about $1.78 million in a year. There's another organization we worked with. It was a radiology practice. They had 8 physicians across 5 locations. We were able to reduce the no-shows by 12.5%, which translated to $780,000 per year. Now, I want to just highlight something about these 2 practices. They had a significant revenue impact, but more importantly, as soon as we implemented these sort of automated reminders and were able to use this technology, they started to get compliments from their patients. Right? Their patients would actually come in and say, wow, thank you for reminding me about my appointment. I would have totally forgot. Thank you for that text. Or thank you, it makes me feel that you guys really care about me. You sent me some instructions of what I should do prior to my appointment. I didn't feel as nervous coming in. But radiology is not, some patients like myself can get really anxious ahead of a radiology appointment. I don't know what to expect. Am I going to be put in a machine? And so what this organization was able to do is in their reminders and their outreach, they were able to offer the patients, well, if you're concerned, press 2 right now and you'll be connected back to our office and we can answer your questions and your concerns. And so what happened was the patients would arrive on time, they're much more calm, and it really smoothed out their operations. So although we're talking about revenue, and I can capture more of it, there are some significant operational benefits and cost savings that can happen as well, which is something that Matt talked about earlier, how by focusing on revenue, you can actually impact the cost side as well. So what's the key to some of this automation? I mean, it sounds really great, Colin, we can just implement these sort of automated reminders. What's the key to that? I get asked this all the time. The real key to automated success is what we call real-time synchronization with your electronic health record system or your practice management system. And what this really means is that you really need that linkage with your schedule in real time in order to avoid a lot of headaches and in order to make the system very effective. Because locked inside your schedule, locked inside your EHR, is the preferred contact method that the patient likes. And so if we're able to tap into that, then you can deliver the message in the way that the patient wants to, which obviously increases the likelihood that they're going to respond to that message. Also, you're just not going to piss them off. You're communicating with them the way that they want to be communicated with. As well, the responses that you get from the patient to say, yes, I'm coming, or no, I have an issue, or hey, I'd really like to talk to someone to reschedule. We want to feed that back into your EHR because that can lead to some really cool insights. The patient may have said, I really like you to communicate with me by email, and yet they always seem to respond to the voice. So that may be a trigger for you to say, hey, you know what, maybe I need to change that flag inside my EHR. As well, we have the ability to see immediate changes when you have real-time synchronization. What do I mean by that is, for example, let's say in the morning someone calls into your office and cancels an appointment. Well, the last thing you want to have happen is for you to send a reminder for that appointment to that same patient that day because they've already called and canceled it. Without that real-time synchronization, it will be an unideal patient experience. They'll be pissed off, basically, that you're calling them for an appointment that they've already canceled or rescheduled. So that's why real-time synchronization is very important. It leads to a much better patient experience. In that EHR, once there's access through real-time synchronization, there's a whole bunch of clinical information, there's a whole bunch of other information which can become very, very useful. And how it can be useful is that you can then layer on top of these simple appointment reminders other ways of communicating with your patients. So with real-time synchronization, you can start to do things like post-discharge follow-up instructions. This will really help your readmission issues. You can also start to really enable your population health and wellness programs, which can actually represent some new revenue. So with this real-time synchronization, you can really tap into this wealth of information inside your EHR. Now, what I'm showing here is an example of a wellness or population health message, because population health means different things to different people. The example I'm showing here is basically a reminder for someone to make an appointment. So this is not someone who has an appointment. This is actually a message to say, hey, based on your risk profile, based on something we know about you, we really care about you, and we really believe that you should come back in and have an annual screening done. In this case, a mammography screening. So this does a couple of things. First of all, pop health is a growing area. It's something that people like CMS and others want us to do. But it's also an easy revenue win, because what you're doing is you're encouraging people to connect with you. You're encouraging your patients to come back in for something that will really help them in their health. Patients love this as well, because it really helps them feel that they are being cared for, that you as an organization are really caring about their health. You also improve their engagement level. Usually in these pop health messages, what you'll see is that there's links or there's information from trusted sources to say, 1 in 5, of the people who do this have this kind of outcome, and you really think someone in your profile should really be doing these things to maintain a healthy lifestyle. That type of information is valuable. And when information is shared, patients normally get more engaged. When they're more engaged, of course, there's a tendency to have a healthier outcome. Population health, you guys are probably already doing something in your organization. You can layer on this automated communication to really accelerate it and really make a big difference. There's obviously some other examples that I have listed here. We can do colon screenings, flu shot, diabetes, really lots of things. But again, the bottom line here is that hopefully by going through some of these examples, you can see there's some easy wins inside your organization to improve and enhance your revenues without having to take on huge, massive IT projects, without investing tons and tons of resources here. These are fairly simple things to do. We would love to talk to you about that, but you can even do it yourself. Just look at your schedule, see and determine what your fill rates are, determine what your no-show rate is, and then from there, start to implement some of these things and measure it. And that'll really make a big impact on your organization. And with that, I will just hand it back over to you, Andrea.
Well, I'm smiling here because if you think of old Kiss, keep it simple, stupid. I mean, it's so interesting to us. We work with medical centers and multi-specialty practices and individual practices, and I'm sitting here wondering why this is so hard to understand. The other side of it, though, takes us right back to the changing consumer. You may not have a choice, because consumers today have choice. So I wanted to wrap this before we go into our question section about thinking through whether you have any options or how fast can you move to do what really is both not that complex to do, but seems like it's right before us. It's like this acres of diamond that is right before our nose that we're not paying attention to. So I often go back to Deloitte has wonderful research every 4 years. The last one happens to be 2012, but it's as relevant today as it was then. And their survey of consumers was pointing to a massive shift in consumers. People have become activists in healthcare, and they're consumers of healthcare, and their research was basically pushing us to stop thinking of them as sick patients who are broken and dependent upon us, rather than persons. And that Amita story, I told you the conversations I had with the folks who were managing the call center was that these are just people who need a hand. It was a very interesting person-driven approach, which is basically the same thing that Colin and Matthew are talking about here. These are people who need you, help them get the care they need. The other part is that millennials don't have doctors the way that you might think. Boomers and Gen Xers, perhaps 82%. But this comes from Klein and Partners research, but only 60% of millennials have primary care doctors. Only 60% of men have primary care doctors. The relationships that you think people have with their physicians are changing. And on top of that, they have lots of choices. We're working with urgent care centers, and I don't think that the proliferation of urgent care centers is being missed, but the fact that consumers now can choose a CVS, a Walgreens, in some places even a Walmart's to walk into, for both chronic illnesses and a bladder infection or a bronchitis is no longer simply waiting for your doctor to have an appointment. So if there's a big gap in your business, you need to step out of it a little anthropologically and take a look at all the changes that are happening. Consumers are becoming activists in part because they have to. At times, they have new health circumstances. We know one woman who had a bad knee, and she went online to search all of her options before she chose a doctor and a place that does a lot of the kind of surgery she needed. And when she went into him, he said, "How did you find me?" She said, "Online." It was as if it was no big deal. The loss of employer-sponsored coverage is a very big deal. We did a bunch of research with people who are patients of different healthcare systems, and they just now have to learn a whole new way of thinking about care and the cost of it. And men are getting much more involved in providing it. So now how do we begin to rethink our call centers and how we connect with them to ensure that the care they need, I mean, that text messaging shouldn't be underestimated. The inability to get the care they need at the price they can afford, constant conversations with doctors. Typical, a patient needs x-ray and lab work, and instead of saying, "Where shall I get it done, doctor?" he says, "I'm going to go online and see where I can get it done at which price. Aren't they all the same?" And since he had a $2,500 or $3,000 deductible, he wasn't going to simply take the place the doctor suggested. There's also a loss of trust. So all of this ties back into you can rebuild trust. As Colin was saying, if only you think of me as a person, not as a patient, and I'm not simply going to come to you because that's the place to come. I have choices, and I have a whole new relationship with you. Those person consumers know the difference. That's how they shop everywhere else. There was one great story of a woman in California, in San Francisco, and she needed to go see a doctor, so she went online. So who had an appointment available when she needed that time, booked it in online, and then went there. Not a relationship or a long-term relationship, but she did it all online. So now the question is, how do you capture them? How do you develop the right kind of system like Stericycle is talking about so you can convert them into really delighted customers? How can you take those calls coming in and the appointments that are being made and turn them into a higher revenue stream? And how do you delight them so they think that you care about them as opposed to being totally functional? I can't emphasize enough that people buy with emotion and justify with reason, and therefore how it felt is as important as how good it was. Now, we had asked you for some questions, and we had some great questions come along. So let me share them and have Colin and Matthew, and I'll chime in occasionally to talk about them as well. First one is, where do you find those quick wins that could be really big wins in the organization? Colin, Matthew, who would like to start?
Yeah, Andrea, I'll take this one. So I think typically where we find is, again, it kind of comes back to that concept of not feeling like you have to boil the ocean. At least from a hospital standpoint, where the biggest impact is really starting with departments that are more of the high revenue generators, such as radiology. A pretty easy one to implement some easy solutions or practices that have a quick return on investment. Some of the high volume areas that you can really tie to revenue, that you can take a pretty quick look into schedules, and you can see fill rates, and you can see abandonment rates, or from a call standpoint. But focusing on those specialty areas that tend to be the higher dollar revenue, even orthopedic programs, because we know the value of a patient in those specialty areas are high. And Colin, I don't know if you wanted to add anything to that or even expand that a little bit into the physician space.
And we're talking about the hospitals there about some high. I think the key really, Matt, is you're looking for an area with high dollar value and high volume, and which, as you said, is typically a radiology department. I mean, in a physician practice, it's a little bit different. In private practice, where we tend to find people will typically start is with a physician who basically gets it. So rather than focusing on specialty or dollar value, what you're looking for is a physician who goes, yeah, I really understand it. I really understand that patients want to be communicated with in the manner that they prefer. I really understand the need to make sure my schedule is filled. And so you want to find that, I call it the activated physician, who really is excited about applying this kind of live operator and this communication methodology to what they're doing. Because I think once you find that, everything else becomes easy, because then you have like a really passionate champion. You have someone internally who can be your sort of standard bearer for the rest of the organization. So in a sort of a smaller organization, we always recommend you look for someone who's just excited and eager to apply this technology, who really believes in that sort of consumer, patient-centric approach to what they do.
How about the next one? Will patients really like email and text communication?
Yeah, maybe I'll take this one. It's funny. I think if we had kind of done this a couple of years ago, it would just be phone. I mean, most people still like the phone, and they still do. But there's been some recent surveys and some work being done by Accenture, who basically polled patients based on age, and in that 35 to 55 age group, 70% of the people who responded said they would prefer, if their primary care physician, if they have one, they would prefer to communicate with them electronically, which means by chat, email, or text, or online via a portal. They still wanted phone if they really had an issue, but majority of the time they said, just email me, and that's fine. I would love to email my primary care physician. That's essentially what they said. So, we do get this question a lot, where people are like, well, I'm not really sure about text. I'm not really sure if my patient population wants it. You'd be surprised, actually, at how many people actually want text. You'd be surprised how many people prefer the email, because we're all very busy, right? Everyone's got busy lives nowadays. We got kids to take care of. We got jobs. Asynchronous communication, as we call it, which is electronic communication, is preferred. You can text me. I can text you right back. Or if I'm doing something right now, it doesn't mean I have to respond right away. You're not interrupting me, my day, so to speak. I can respond back to you when I have time. That's the kind of prevailing theory or prevailing experience that people want. So my answer to that is, your patients may not actively tell you that they want electronic communications, but everything is pointing that way, with smartphones, with the way they live their lives, with the way they communicate with their banks, and all. It's moving that way. So
I'm going to add two stories. We worked with physicians out in Michigan, and the pediatrician's marketing strategy was to give her cell phone number to all of her patients and said to them, text me. She said rarely did they text her, but it was the biggest viral marketing campaign you could imagine, because everyone talked to everyone about their doctor giving them her cell phone. And they all knew that they could get a hold of her by text messaging if they needed her. And they were very respectful of it. She just had a separate phone, and that's where she communicated with patients. So I add that to the mix, because I do think that the doctors who get it are doing it tactfully, and the patients are using them appropriately. And then we had a customer care client for a long time, and we had them sit on their phones, and the average age of the person who was calling was over 50. And I make that point because they used to write letters for customer care. These are like the 800 numbers. And then they went to the telephone. But young people text. And it was that aha moment for that customer care business to realize that the 50-year-old and older was the past, and the future wasn't going to use telephones the same way they used to. They still do, but not the way they used to. And unless you can chat, you can email, you can text, and you can make it available in multiple or omni channels, you are missing out on how people use systems. So, Matt, do you want to say something on this one?
No, I actually thought between you and Colin, you kind of covered it with kind of looking at the next question on how to segment into that a little bit.
Well, go ahead. Why don't you take the executive buy-in question?
Yeah, because I think it kind of ties in, is that we end up getting actually this question a lot, because I think one is it's almost this ability to really focus. And I think when we look at from an executive buy-in standpoint, what we found is there's a lot of areas that are what we would consider soft, or maybe not kind of that hard data. There's some really good tools out there, and we have one as well, that really looking at the return on investment. I think a lot of the challenges that we see in organizations that have jumped into big initiatives, especially communication initiatives, is when you really start looking at the numbers, it has to make financial sense to jump in. And if you haven't kind of run the numbers before, then the risk is that you end up putting all this work, and then you run the numbers on what it's going to cost to implement a program, and the return is not there. And so there's some really good calculators. Again, we have a really good one that becomes a pretty easy way to be able to tie in the initiative into real dollars. And so being able to present that, again, I think from an executive standpoint, is that there are so many things going on, and there's so many initiatives that if you can really start with the basics to say, I've done the research, and I've looked at this, I've looked at our fill rates, I've looked at our no-shows, the impact of implementing a program in even a specific area is hard dollars, and this is what it means to the organization. That's a great place to start. Again, go ahead, Andrea.
No, I was going to add to that. The Amita folks said it wasn't hard once they sat down with their CFO to show the 15,000 appointments that they could count and make, and the ones that were kept. The data drove the mind share change from, wow, this isn't an expense, to, wow, without it, we're going to go out of business. I mean, this was really the aha moment. And so you can almost start with your chief financial officer, because if they adapt it, they almost drive it. And they want to know, how many appointments did we make this week? How we changed for last week? How many are calling and dropping? I mean, it becomes a business as opposed to irritant. Interesting, isn't it?
Yeah, absolutely.
So with that, I always like to, I'm going to wrap up and thank Colin and Matthew in 1 second, but I'd like you to see how this ties into our next webinar, because it's a wonderful setup. If you can think, I was fascinated as these all came together, because everything is changing in healthcare. Today we're talking about how to turn your cost savings strategy to reduce expenses into, oh my gosh, I'm cutting off my, it's not really a good strategy at all. And that's where all the opportunity is. And even if I just do a better job of making those appointments and keeping them, we're going to make more money. And then Linda McCracken, who's the principal at McCracken Consulting, will be bringing Tim Crowley. And Dr. Crowley is president of Pinnacle Health Medical Group. And this is sort of another sidebar to the whole conversation about how the physician marketing partnership can lead to new patients. And all of a sudden, all the things that were sort of expenses, marketing, call centers, are now becoming opportunities. And if I could tell you, as a person standing out looking at the trends, there's stuff coming that is shifting those relationships and reversing them from bad to good, and almost like, wow, how did I miss them? I do want to thank Matt and Colin. This was absolutely a perfectly timed, really great webinar. And we open it up for you who might like to email us for additional conversations. It is a conversation, and story is going to keep going on. And I can't tell you how much we enjoy having you today. Matt and Colin, thank you so much. I know this is a really important time, and it's almost a weekend. So thank you all. And is there anything you'd like to end with before we say goodbye, sirs?
No, Andrea, from my perspective, thank you so much. I think the only thing I'd end with is that this whole communication discussion, and I think you summed it up really, really well, is that I think in the past, contact centers or communication really was seen as a cost center. And if you can almost dial it back a little bit and get laser focus on a couple things, that you can move a cost center into a huge revenue center. By some quick wins and kind of starting with the right areas. So anyway, that's what I'd like to.
I can't say ditto loud enough. Colin?
No, I think Matt said it most eloquently. There are opportunities. They appear pretty small, and yet they can have a big impact. So we hope today that you guys, everyone on the webinar today, was able to learn a little bit something about how something as simple as a schedule can yield some big dollars. So much for the opportunity.
Thank you. Thank you, all of you who attended. We'll be turning this into a video, putting it up on YouTube, on our website, and emailing it out to everyone who both registered and attended, and registered and didn't attend, and everyone on our mailing list. So we love to share it. Thanks so much, and let us know what you think, because next year is coming, and we'd love to plan next year's webinars as well. Goodbye, gentlemen. Signing off.
Andrea.
Bye now.
Thank you.